Good afternoon. My name is Zoe Vella. I'm a pain medicine specialist from the Tess Cramen Pain and Research Centre in Brisbane. And I'm here with Dr Sav Zwickl, who's very generously spoken to us about insights into pain in trans and gender diverse populations during one of our Faculty of Pain Medicine sessions today. So thank you for joining us, Dr Zwickl.
Thank you.
So just to tell everyone a little bit about you, Dr Zwickl is interdisciplinary researcher and educator with a PhD from La Trobe University, but your research is currently based in the University of Melbourne. And one of the things that I think has been a focus of your research has been leading the Transform project,
Yes.
Which is one of the largest studies that's been done sort of longitudinally into trans health. So can you tell us a little bit about what are some of the most important things that you've found out doing that research?
Sure. So coincidentally, Transform marked its 5-year birthday this year, so this week. So very proud of that. Essentially, there's very little research in trans populations, and a lot of it has been led by cisgender people, so people who aren't trans.
Yeah.
And trans people themselves haven't had a lot of control over the research that's been done about them. So what's quite unique about this study is that it is trans-led. Trans people are involved in every stage of the research. We have over 2,000 trans people who've been involved. Some of them have been involved since day one, so for 5 years now. So it is a longitudinal project. We've covered a range of different trans health topics, and they've been very priority focused. So we've done quite a bit of research around the impacts of the COVID-19 pandemic on trans populations, looking at mental health and how that's changed over time. Most recently, we've looked at the impacts of like housing and employment and anti-trans media on mental health in trans people. So very much responding to the changing needs of the community. I think what is one of the greatest things I've learned in this process, I guess. Trans people are just so generous, I think, with their stories. I think it's been such a beautiful thing and such a special thing to be able to be the holder of so many people's stories, because a lot of it is just surveys, but a lot of it has been like people sharing their stories with us, and some of them are been stories full of pain and struggle, and some have been about the joys of being trans and how their life has transformed since they've started gender affirmation. So it's been really just beautiful.
Yeah, that's really good to hear. You touched on some of the mental health struggles, that have come about, or become more apparent in your research. When we're thinking about pain medicine, we approach patients from a socio-psycho-biomedical perspective, and you touched in your presentation on some, the fact that trans and gender diverse people have challenges across all those areas, which might explain why they have a higher prevalence of pain. So would you just give us a little brief overview of some of the things that you might consider to contribute to that higher prevalence?
Absolutely. So unfortunately, what we've seen in the last couple of years is a real marked escalation in anti-trans rhetoric and anti-trans policies that impact or restrict people's access to gender affirmation healthcare, or to gendered spaces, as well as an increase in anti-trans violence as well. And so these, I guess, environmental or social drivers are really account for some, like the high rates of poor mental health we see in the trans community. So I did mention in my presentation, almost half of trans people have attempted suicide at some point in their life. That is just a staggering statistic, and really kind of indicates something of the challenges and the struggle that trans people are facing. And so, that's what I've tried to cover in my presentation today, was to kind of explore some of those factors, to reveal the degree to which, trans people are exposed to discrimination and how prevalent it is throughout the lifetime, and that mental health disparity that we see as well, as well as when trans people do seek support from healthcare professionals, be that for their mental health or for pain or for other health conditions, it's really challenging to find a healthcare professional that understands trans health and has the knowledge and the skills to treat them with the respect that they deserve. And so, you know, it's really common for trans people to delay seeking healthcare because they are scared of what their experience might be. And so that can exacerbate pain as well, right? So there's a whole range of factors that come together that might account for that high prevalence of pain in that population.
Yeah. So you mentioned, and you know, most of us understand that we have really limited education about care for trans and gender diverse people in medical school and throughout specialty training. What are some of the resources that looked really good when you showed them up there that we can access as health professionals to try to, you know, make our care, you know, the best possible it can be?
Yeah, so it's really great that we've seen quite a few resources come out, say, over the last 3, 4, 5 years to help clinicians, because we know that you're time poor. And so it's really great to, you know, have very easy resources that you can pick up and refer to. So if you have a patient come in who is trans, that you've got something there that you can quickly look at, oh, these are the kind of key things I need to be hitting on today. So Trans Hub is one of those resources. So it is a website. It is run by trans people and it has a lot of resources for clinicians. Again, really easy to access, kind of, you know, your one-page type situation with a lot of the key information. And the Trans Health Research Group, which is who I work with at the University of Melbourne, we've also collated a lot of professional resources. So there are, you know, links to free and fee-paying kind of modules or courses that you can do around trans health. Treatment guidelines across a different a whole range of specialties. For researchers, people who are in research. There are now guidelines on how to be more inclusive there as well. And we've seen in the research space a shift where, like, the NHMRC and MRFF are now requiring trans inclusion in research as part of their grant requirements. So that we're certainly seeing a shift there as well, which is great.
Yeah. One of the things that I thought would be of particular interest to our anaesthetic colleagues would be the guideline that you flashed up that was published last year in anaesthesia, or early this year in anaesthesia, that was sort of co-designed by Dr Chung, who presented at the ASM last year. So that's something that I think our anaesthetic colleagues will find really valuable to have a further look at. Thank you so much for your time and for coming and sharing with us, Dr Zwickl, and I hope you really enjoy the rest of your time in Far North Queensland.
Thank you. Thank you so much for having me. It's been a pleasure.
Thank you.